So think about if you had a death in the family and you were just really unable to process that death because it was too important and too traumatic and too difficult. If you didn't come to terms with the fact that that person had died, and that's a natural progression of life, and you were unable to deal with those emotions, don't you believe that you would be in a state probably for the rest of your life that you weren't able to heal and be healthy because you didn't process?
Health, fitness, mindset, nutrition. Live better and longer. I'm Saad Alam, and let's hone in. Talk to me a little bit about, too, that when soldiers have their hormones imbalanced from all of these environmental exposures, I wouldn't say the place that they're in, how does that cause mental health problems?
Gotcha. So traumatic brain injury is part of this, PTSD, service-related depression, all of these things that happen because the human mind and body are not able to heal and conceptualize, heal from and conceptualize what they've seen and been through. All of those things eventually lead to hormone disruption, in particular estrogen and testosterone change. So as stress goes up, we know stress causes inflammation. We've talked about that already. And as inflammation goes up for men in terms of testosterone, not only do testosterone receptors downregulate in the hippocampus as well as do estrogen receptors, but men convert more T to E as a neuroprotection in brain damage from TBI because of all the inflammation in the brain. The estrogen supports the astroglia in the brain. And then inflammation also causes aromatization in the body. So not only are you being exposed to endocrine disrupting chemicals that are often xenoestrogens, so they're chemicals that look like estrogen that cause the disruption, but you're also in an inflammatory state where aromatization, where T is making E, because in men, estradiol is made from testosterone in the majority of the cases. And so you're making more estradiol because of this inflammatory push for this particular enzyme, which matters quite a bit, and it causes the loss of T, which is one of our protectors. For men, it's a great protector in terms of mental health and inflammation.
So I was at a wedding 2 weekends ago with a physician that does research, and when I told him that these endocrine disruptors resemble estrogenic compounds, he said, that doesn't make any sense. I said, no, they literally resemble estrogen. They get into your body, they fight for space on all of your receptors, and if you flood your body with them, that tells your hypothalamus that you have too much estrogen, tells your pituitary to stop luteinizing hormone production, and all of a sudden your testes are not producing testosterone anymore. And he says, it doesn't make sense to me. I said, listen, I know it sounds crazy and conspiratorial, but it's happening, and it's happening across not just the country, but the world. The thing you said, which just blew my mind, was the fact that when you're under stress, the aromatization or the conversion of testosterone to estrogen is actually accelerated. So it means you're even throwing more estrogen into your body.
Yeah.
And now listen, estrogen is good in the right amounts for men, right?
Absolutely.
It's neuroprotective.
Absolutely.
It helps us with our bone density. But
sexual health, metabolism, you have to have it, but it's a narrow band hormone for men.
Yep.
T is not a narrow band hormone for men. We need the T for many reasons in men, but men need estrogen and the balance of T to E to be just right. And the balance of T to E is a smaller percentage of E in relationship to testosterone, which is different for women. But in men, that ratio is more important in my practice than almost anything else.
I'm going to ask another question, which you may or may not know the answer to. I don't know if anyone does. So I understand, right? If you have traumatic brain injury, if you're constantly under the threat of a bullet flying by you or you dying at night, that's going to cause like some kind of PTSD to a certain degree, right?
Yep.
Does a hormone imbalance, whether it's less testosterone or more estrogen, accelerate that or
accelerate the outcomes of endocrine
or mental health?
Oh, that's a good question. Well, I think theoretically speaking, yes. So we'll go through a little bit of the pathophysiology. So TBI, that literature hasn't panned out whether TBI causes low T or not. But in terms of pathophysiology, which is kind of how we have to do these iterations in our minds as functional medicine providers and as researchers, because the research, as we've said before, is almost impossible to do in the scenarios and in a direct one-to-one relationship because there's so many factors. So TBI causes obviously brain jarring and brain trauma. PTSD is related to TBI, and so is major depression, which is related to PTSD. So all of those lower T by direct mechanisms that we know about. So we know that PTSD and depression cause low T, and that TBI causes mixed results in terms of studies. Some people's T rebounds, some don't. The studies are very mixed, but the pituitary hangs in the brain on a stalk, and it's a mobile stalk, and that stalk gets compressed and sheared in a TBI, and shearing and compression, particularly compression of the pituitary stalk, is known to cause prolactin elevation. Prolactin is what suppresses testosterone. So if your prolactin is up, your T is down. And so that's a very known mechanism that TBI could and does affect testosterone, as well as that estrogenic protection we talked about, where T converts to E to protect the brain. That astroglial protection that estradiol can bring will cause over-aromatization in TBI, which lowers the T. So there's some very well-known and very direct mechanisms that T goes down in TBI.
Wow.
Yeah.
Now, another number that we've heard is as many as 20% of soldiers have PTSD. I mean, that's a massive number.
It is.
Talk to me about what PTSD really is, and maybe even some of the pathophysiology, if you can jump into it.
Sure. So I think in the big picture, we think about a trauma that's unable to be digested and processed and released. And so trauma getting stuck in the brain and in the body is really what PTSD is.
What does that mean? How does trauma get stuck there?
Imagine think about if you had a death in a family and you were just really unable to process that death because it was too important and too traumatic and too difficult. If you didn't come to terms with the fact that that person had died, and that's a natural progression of life, and you were unable to deal with those emotions, don't you believe that you would be in a state probably for the rest of your life that you weren't able to heal and be healthy because you didn't process
100%.
that?
100%. I've seen it go the right way. I've seen it go the wrong way. I know someone right now that's in it. And it is, I keep on, my sister-in-law's in it right now. Her brother, unfortunately, passed away at the age of 30 years old in his sleep, no prior health problems. Yeah. And I said, look, you've had 2 months, 3 months. You've got to figure out how to process it so you can get through it.
And that's why the mental health component, the behavioral health component is so important, because if you do not process emotional mental stress, it does begin to create a wedge. And the amount of inflammation, the assimilation of memories, the creation of depression, all of those things sort of are in this interplay that's not understood and not well known. But as a behavioral health clinician, I've seen it time and time again, and it's literally the trauma just getting stuck. That's not scientific to say, but we don't know exactly what happens, but it's not processed. And until it's fully processed and able to be released, it's kind of like an echo bouncing around on a cave wall, and it does a lot of damage.
The way I would almost maybe say it differently is, the moment you go through something traumatic, the emotions that you have consistently kind of create this self-defeating negative feedback cycle. You're thinking about it over and over and over again, which is your equivalent of bouncing back and forth in your head. Normally, you come to grasp with that and let it go. Right. That's your equivalent of the release. Right. But in some percentage of people, you can't break out of that feedback loop. And it's just constant over and over and over and over again.
And that's why getting our vets plugged into mental health care that's meaningful and that has a cognitive behavioral therapy component is so important, because that's what the behavioral therapy does. It works the kinks out of that muscle that's just tight and won't release.
Yes. Yeah, I can. And it's so interesting because this is a horrible example, but one that I think a lot of people that can relate to, is if I get into an argument with my fiance, or if there's something I want to say to her, and I know I won't step on that bomb, because if I do,
you got to dance around it.
I gotta dance around it. My life becomes a lot harder. But if I hold on to that one thing I need to say for too long, it actually creates real changes in my body, rather than just saying it, getting it out.
Yes, well put. And you're in tune with your body. You're a healthy guy. You're doing this work. You're doing so much learning, and you notice those changes. Imagine being in a place where you don't know if you're going to live or die. How would you even pay attention to something like that? And you come home, and all of this is in there and is creating emotional, mental trauma, and all of the downward effects that relates to in terms of health, which begins with inflammation, but is not only related to that, because the mental health is so keenly tied to physical health that we don't even fully understand it. And so it's impossible to imagine not getting help for PTSD and being able to be well. because the diagnostic criteria for PTSD in the DSM-5 is quite robust. It's very detailed. It's above and beyond the conversation here, but it would require a full psychological or psychiatric evaluation, multiple interviews with the interviewer, and criteria to be met. But generally speaking, if you're reliving a trauma, if you're hypervigilant and jumping at any sound, if you're having trouble sleeping, you're starting to get depressed, and you're avoiding any reminder of that trauma, a sight, a smell, or a sound that could take you back there, nightmares, of course, are a big part of that as well. But if you're in a situation like that and it's related to something that's happened traumatically to you or someone else, you need to be evaluated for PTSD.
But you know what I think it's the scary thing for a lot of men is? When we use language like evaluated for PTSD, I think that makes it almost feel like something's wrong with us to a certain degree.
Right.
When it's like, hey, I don't want to admit something's wrong with me. There is something wrong with me, but I almost don't want to admit it necessarily. Yeah. I would say, you've talked to probably thousands of men, tens of thousands of men. How do you think we talk to them to feel comfortable about therapy? Because I will tell you this, right? I've got an executive coach and I've got a therapist. God bless. Because if I didn't have the both of them, I would probably be all up in my head even more than I probably am right now.
Yeah. And so there's some sort of bridging process. Spouses help with this as well. But I think the concrete discussion with a medical provider that says, here are the physiological effects. Like when I look at certain labs involving testosterone for my patients, when they're soldiers, they not only have typically low T, often inflamed livers, often elevated estradiol, but they have other things that I can look at as a concrete lab result if I'm able to test it at that time and show it to them and say, this is the thumbprint of endocrine disruption and toxic exposure. If you're experiencing these sorts of things and we're seeing it in the labs, this is beyond some woo-woo psychological topic that you're not willing to go into because it's not concrete enough. And this is a physiologic response. We didn't used to understand these things, and now we do. So it's just catching people up to speed. Because all those walls typically dissolve when you can show proof that it's a medical issue to the brain. It kind of clicks into place.
Oh, that makes a ton of sense.
Yeah.
Right? Because then in that way, it becomes this hard, ambiguous, nebulous thing to get your mind around that you don't necessarily even know how to peel back to. Oh, look at the concrete numbers. And that makes sense because if I were to figure out how to get this fixed, a lot of these other things would get fixed as well too. And you're just telling me I need to sleep a little bit more and talk about my...
Maybe talk to a therapist, maybe even take a med for PTSD. And the cognitive behavioral therapy process for people to kind of go through treatment for trauma is very concrete. It's not just talking to some therapist about how you feel. It's particular exercises you do, and you do them daily. And so the therapy techniques are very concrete. So as it turns out, they typically do appeal to even servicemen that didn't want to get it done.
So these are not things like, tell me how your father treated you when you were young. These are like very well-known exercises that you go through that are probably not going down to that level necessarily.
I mean, the process of having PTSD is also knowing that not everyone gets it in the same experience. So 15 to 30% of people exposed to traumatic experiences in the military service would come out with PTSD. And so one person can have the same experience as another and not get it. So pre-existing processes through birth, through fetal development, through childhood trauma, all these things kind of prepare and set the stage prime the pump, so to speak, for PTSD. So getting into childhood may be important in some sort of esoteric way because of knowing that this set you up to have been in a different space, neurologically, maybe even neurophysiologically, but also psychologically to be at risk for this. And so some of that's part of it. And if even just to say that there's nothing wrong with you. Just because your friend in service right beside you didn't have this same outcome of PTSD doesn't mean that you're broken. There's nothing wrong with you. Everybody's life experiences and in utero development matter in terms of these things.
That's so important. I think a lot of people think that, hey, if my friend didn't have that, I shouldn't have that.
Right.
But what people don't realize is you are so incredibly complex and individual in your own right. And the thing that's going to work for you is going to be dramatically different from the person next to you or even your brother or your spouse for that matter.
Absolutely. There was an interesting study I read a long time ago about chronic pain, and there was an ortho unit in a hospital, pretty high number of patients, that was able to look at functional imaging of the brain, and the greater white matter ratio accurately predicted who would have a chronic pain transition from an acute orthopedic injury. And this sort of thing, where just the way the brain itself was mapped mattered in predicting who at high likelihood would have chronic pain, I think applies in this sort of situation, that the brain is at risk in certain people, and we will do a better job. In the future, these sorts of things will be known, and we will say to our veterans, hopefully, you are at higher risk, because we will have that technology.
Well, I think we're right at the cusp of that. And what I mean by that is, right, I've been looking at 300 biomarkers every 90 days. I just did a pre-nuvo scan. I've been looking at all of my different physiological functions using my Whoop, my Oura Ring, my 8 Sleep. And I think that the rest of the world is catching up, because in just the past year, longevity and functional medicine are arguably some of the biggest topics, because we've looked at our friends and our parents that have been through really crappy circumstances, and we've said, no, not us anymore.
We're not doing this,
And so I think 5 years, I think the military starts catching up with a lot of this stuff. And 5 years sounds like a long time, but really it's the snap of a finger. And that would actually be fast, I would argue.
And I think veterans working with companies like yours will have the information and the fuel to push. And on a national stage, social media and national coverage of things like this is bigger than it's ever been. So I think the future is brighter than we think.
That is, I couldn't agree more. I actually feel like we're in a really positive place in terms of where we were, like I said, even 5 years ago.
Agreed.
I want to touch on one other thing, sleep. You've talked about how important sleep is, and that when you go to sleep, it serves a lot of restorative functions for the body.
Absolutely.